Patients and doctors are partners in care, and because of that, it's important that you understand your own health results. As doctors, we do our best, but most of us take care of hundreds, if not thousands, of patients at one time. And occasionally, things can be missed. You are your own best health advocate. So my goal today is to help you understand your test results so that you can feel confident, informed, and empowered. Today, I'm starting a new series. We'll begin with blood work, and later we may expand to other common medical tests. If that sounds helpful, please consider subscribing. Today's focus is the complete blood count, otherwise known as the CBC. It looks at three main things: the red blood cells, the white blood cells, and platelets. We use it to look for anemia or iron deficiency, infections or inflammation, and sometimes it can give us clues to more serious conditions. Let's start with red blood cells. The two most important values here are the RBC count or erythrocytes and the hemoglobin. The RBC count tells us how many red blood cells you have, while hemoglobin tells us how much oxygen your blood can carry. If both of these are normal, then you usually don't need to worry about the rest of the red cell values. If hemoglobin is low, that means anemia. The next number we look at is the mean corpuscular volume, otherwise known as the MCV. MCV tells us the size of the red blood cells. So if the MCV is low, the red blood cells are small. This commonly points to iron deficiency anemia, which the low iron affects the production of red blood cells, or thalassemia, which is genetic, in which the individual just produces small red blood cells. Doctors usually order a test called ferritin, which measures iron stores. So if hemoglobin is low, MCV is low, and ferritin is low, that's iron deficiency. Whereas if ferritin is normal or high, thalassemia becomes more likely. A helpful clue: iron deficiency usually lowers the RBC count because production is limited, while thalassemia often has a normal or even high RBC count because the production is normal, just the RBCs are small. Other values you might see include the mean corpuscular hemoglobin, or the MCH, which tells us how much hemoglobin is in each red blood cell, which in both cases would be low because of the small size of the cells. And the erythrocyte distribution width, the RDW, which tells us how much red blood cells vary in size. RDW is often high in iron deficiency due to the production problems and normal in thalassemia. Conversely, if the MCV is high, these RBCs would be larger than normal, and that usually points towards vitamin B12 deficiency or folate deficiency. These vitamins are needed for cell division, and without them, red blood cells become large and inefficient. Finally, if hemoglobin is low, but MCV is normal, it suggests that something different is going on. This could be decreased production of red blood cells, such as bone marrow disorders or kidney disease, blood loss, such as trauma or surgery, or increased destruction of red blood cells. We can see that MCV is normal because these issues cause anemia, but would not affect the size of the RBCs. Now, let's flip it around. What if hemoglobin and RBCs are high? This often happens when oxygen levels are low. Common causes include smoking and sleep apnea, in which you stop breathing during your sleep, causing periods of low oxygen. The body tries to compensate by making more red blood cells. This is where hematocrit matters. Hematocrit tells us how concentrated the blood is. Hematocrit, understandably, increases because with more RBCs, the blood becomes more concentrated. But if hematocrit is high, the blood becomes thicker as well, which can increase the risk of clots, heart attacks, and strokes. Now, let's move on to white blood cells, the WBC. White blood cells are affected by infection and inflammation, If the WBC count is high, it often suggests bacterial infection or inflammation or even physical stress. If the WBC count is low, it more often points towards a viral infection or immune suppression. Viruses can temporarily suppress bone marrow production of the WBCs, but that doesn't mean your body isn't fighting. It just fights differently. And that is why we look at the WBC differential. Different white blood cells have different jobs. Neutrophils fight bacterial infections. Lymphocytes fight viral infections. Monocytes help clean up infection and inflammation. Eosinophils and basophils are linked to allergies. Finally, let's talk about platelets. Platelets help your blood clot when you bleed. If platelets are low, there's a higher risk of bleeding. If platelets are high, it is often due to inflammation or iron deficiency. Mildly low platelets are actually quite common. In general, a stable platelet count above 100 is considered acceptable. Anything persistently low or high should always be discussed with your doctor. I hope this gives you a clear understanding of how to read a CBC. Remember, lab results are clues, not diagnoses. In the next video, we'll look at other common blood test values you might see on your reports. If this was helpful, please like the video and subscribe, and let me know in the comments what you'd like explained next.